if you have a discharge that is foul smelling, you need to go see a doctor. You don't need to wash it out. Some people use antiseptic. Some people use acidifying agents like vinegar and such.
Vinegar?
Yes.
They don't love themselves?
So the thing is, there is really no health benefit to douching. Douching only gives you problems. The woman is ovulating, then the discharge becomes like mucus. It's like egg white. You can actually touch it and stretch it out.
So
yes.
it's clearer than...
It's clear.
Yeah.
Yes, it's clearer than it is during the first half of the cycle. A woman knows what is normal vaginal discharge for herself, yes. Especially for younger girls, as they transition from adolescent into now the reproductive age, they will come to you and complain that they have abnormal discharge, or when they are just becoming sexually active, because that's when they notice that there's this discharge that coats the penis after intercourse.
Hi. Now, I don't know if you heard about what celebrity and actress Gwyneth Paltrow did. She started selling a brand of soap that she claimed was very closely related to her. I'm trying to find a way of saying this. It smelled like her. It smelled like her. You know what? On the Med Squad podcast, we're going to get a bit more detailed into that particular region. We're talking about down there care. Specifically, we're talking about vaginal health. Yes, Gwyneth Paltrow was selling soap that smells like her vagina. And so, with me, I have Dr. Mbuche, who is a consultant obstetrician and gynecologist, and one who I know has not bought that soap. But we're going to talk about, we're going to get candid, as candid as we possibly can. Probably cover smells and hygiene and everything to do with vaginal health. Things that some people may not talk about out loud, and especially not around men. And so this is it's a privilege to have you here. Welcome.
Thank you for having me.
Now, as you can see, I'm kind of in a blush demeanor because I don't know how to even approach these questions. So I'll just ask from the basics. What is a normal vagina supposed to smell like?
Okay, so thank you for having me. Maybe we should start from, we should talk openly about these things.
Okay.
And not use euphemisms. It's not down there.
It's vagina.
It's the vagina.
I said both.
And it's not a wee-wee, it's not, no, it's the vagina and it's the penis.
Okay.
So that is where it starts from, having candid conversations about things that might be viewed as embarrassing and such. So to answer your question, first of all, the vagina is not odorless. That's a common misconception, that the vagina doesn't have an odor, or it's supposed to smell like flowers or smell like pineapples. No, it shouldn't. The vagina has a natural odor, which is a mild, musky kind of smell. So musky is very equivocal. Because, I mean, what is musky really? Is it like a wet log? Is it other terms that have been used to describe the vaginal smell is that it smells tangy, because the vagina is acidic, remember? So it can have a tangy kind of smell. And what I find, this is my own personal description of what I think a healthy vagina smells like. To me, I think it smells like raw meat, like a mild, yes, like how raw chicken would smell like, but a mild kind of smell. The vagina has also been described to smell a bit metallic or coppery, like if you had a handful of coins and you smelt them, then yes. Yes.
Hey, that's an interesting description. Now, just to get some myths out of the way, true or false, the vagina is self-cleaning.
So the vagina truly is self-cleaning. And while we are at that, maybe I could talk about vaginal discharge as well. Okay.
Okay.
So just to backtrack a bit, the smell of the vagina changes. It changes from person to person. Not
Yeah.
two people will have the same kind of smell.
Yeah.
There are things also that affect how that area smells, because it's an area that has 3 holes there. There is the urethra that produces urine.
Yeah.
Then there is the vagina. The vagina is the tubular structure that leads into where the uterus is.
Yeah.
And then there is the anus there that usually you poop through.
Yeah.
So there is feces around that area. So these kind of excrements sometimes can affect how that area generally smells. There is
Oh.
also sweat glands
Yes.
around the vulva. The sweat glands that are in the vulva are the same as the sweat glands in your axilla, in your armpits. So it might have a body odor like kind of smell, so
Yeah.
to speak, especially if you've had a long day and all of that.
Okay.
Some of the things that can affect how your vagina smells also is things like menstrual blood. So it tends to be a bit more metallic because there is iron in blood. And then diet also sometimes. When you eat very strong smelling foods like onions and garlic,
Yeah.
the vagina can smell a bit oniony.
Garlicky.
Garlicky or oniony, yes. And this is the thing that people usually say when you eat pineapples, your
Yeah,
vagina
changes
then will taste and smell like
Yeah.
pineapples. It's because of the water content in the pineapple. It really doesn't make the vagina smell like a pineapple, but it makes it more mild, the smell.
Oh.
Yes.
So
And
now, if garlic is doing garlicky things, how come pineapple is not as courageous?
it's because of pineapple is not as strong smelling
Okay.
as say an onion. So while we're still talking about the vaginal smell, I think it would also be prudent to talk about what vaginal discharge is
Yeah.
like.
Yeah.
So vaginal discharge changes. It's not the same. It changes from person to person.
Yeah.
And it also changes according to where you are in the cycle. So when you're having your menses, of course, it's going to be bloody.
Blood. Yeah.
And then immediately after that, it might be pinkish. And then after that, you might see a little bit of a brownish discharge. And then it clears after that.
Okay.
So this clearing means that this vaginal discharge might be whitish or a bit creamish, off-white. Sometimes when it's been on the underwear, might look a little darker, almost tending towards a light yellow, kind of for some people.
Yeah.
And then when you get to mid-cycle, when the woman is ovulating, then the discharge becomes like mucus. It's like egg white. You can actually touch it and stretch it out.
So
yes.
it's clearer than.
It's clear.
Yeah.
Yes, it's clearer than it is during the first half
Okay.
of the cycle. And then after that, again, it's going to tend towards whitish, creamish, and then maybe brownish, pinkish, leading up to the menses. Yes. So vaginal discharge, number one, it's not supposed to be irritating. Irritating means it doesn't cause pain and it's non-itchy. And it's not supposed to have a strong smell.
Yeah.
So it shouldn't smell like fish. It shouldn't smell like anything rotten.
Off. Okay.
Yes. And commonly it's homogeneous. So homogeneous means it's smooth.
Yeah.
When you notice maybe you're having a bit of a lumpy discharge, then it could be abnormal. But at this point, I have to say, a woman knows what is normal vaginal discharge for herself.
Yeah.
Yes, because I've had situations where sometimes a woman will, especially for younger girls, as they transition from adolescent into now the reproductive age, they will come to you and complain that they have abnormal discharge. or when they are just becoming sexually active,
Yeah.
because that's when they notice that there's this discharge that coats the penis after intercourse. Okay, and sometimes as a doctor, the client just needs reassurance. You tell them that this is normal.
Yeah.
Sometimes they go from doctor to doctor thinking it's abnormal, but really it's just a normal variant
Yeah.
of vaginal discharge.
Okay, with all those things happening, I guess it would explain why some women go ahead and use, you know, soaps and powders and all sorts of things that may be harsh on the on the vagina. So how do you determine what is safer or what is safe? And do you need to scrub or just gently balance the pH, I guess?
Okay. So the reason as to why many women might use harsh soaps or powders and chemicals to try and clean the vagina is because of lack of accurate information on what the vagina is supposed to smell like or what the vagina is supposed to discharge. Some of these practices are also brought about by uh, cultural beliefs and practices that are tailored towards pleasing a man sexually, unfortunately.
Okay.
So people will use either chemicals or powders, try to wash the vagina so that it has this flower like kind of a scent,
Yeah.
or so that they are tight enough for their partner. And the reason why it's perceived to be tighter is because the vagina becomes dry. When you wash the inside of the vagina, it becomes dry.
Yeah.
So there is more friction and it feels like the vagina is tighter.
It's just
But
friction.
yes, it's not enjoyable for the female at all.
So it's not healthy to do all these kinds of. Is it healthy? Is there anything that's actually healthy within the cleaning, whether it's the daily bathing routine or use of things like soap?
Okay, so the recommended hygiene practices, vaginal hygiene practices, is like you rightfully said, the vagina is self-cleaning, number one. Number two is that there is normal vaginal discharge.
Yeah.
So when you're washing the vagina, and by vagina, I mean the muscular tubular part
Yeah.
of the genital tract.
Yeah.
You don't need to wash the inside of the vagina. I've seen people do a lot of crazy things, like use a face towel, and they wash the inside of the vagina like they would wash a glass.
Hey,
So take
stubborn
maybe,
stains.
yes,
Yeah.
a face towel or their underwear or something like that and shove it inside the vagina to try and clean the inside. That is not right.
Yeah.
If you have a discharge that is foul smelling, you need to go see a doctor. You don't need to wash it out. So the next bit we are going to tackle is how to clean the vestibule. The vestibule is what is inside the labia minora.
Yeah.
Yes. Commonly looks pink in some people because we are melanated. It might still look darker. So what's inside of there, you clean with only water.
Yeah.
Without anything harsh.
Okay.
So you can just use your hand, or what people usually do for babies, you can use a ball of cotton, put it in water, and you clean that area. Make sure you've lifted the clitoral hood, because sometimes there might be some secretions there. So you clean that only with water.
Okay.
And then what is outside of that, which is where there is hair, the labia majora and the mons pubis, you have to clean with a surfactant, something that has a surfactant. So surfactant is basically something that breaks down fat or oil.
Okay.
Yes, because you have a lot of sebaceous glands and sweat glands there. For some people, if they use normal soap that they are using to wash the rest of their body, they are still okay.
Yeah.
But for some people with some skin conditions or sensitive skin, things like psoriasis or eczema, they would need to use something that's a little milder. So
yeah.
either an emollient or a cleanser,
Yeah.
or something that is non-perfumed.
Yeah.
Yes.
So when you had mentioned the three holes, the urethra, the vagina and
the
the
anus.
So
Yes.
especially for cleaning children or babies. So you mentioned the cleaning. It's the motion. I'd been told about the motion away. I think the
Yes.
direction of motion.
Yes.
Yeah.
Yes. So the cleaning usually is front to back.
Front to back.
Yes,
Okay.
because all these tracts have normal microorganisms that are resident and are beneficial to the body. But if you transport them either from the anal region into the vagina, then it might be a bit of a problem there. Yes. So also, number two, the kind of underwear that you're supposed to wear.
Yeah.
So what is recommended is cotton, breathable underwear.
Yeah.
And then other hygiene practices, there's hair there. So about whether to shave or not to shave, really that's just a personal preference. The hair is there.
Like the hair doesn't protect from.
It does. There is a reason as to why you're born with hair there. It's like your eyelashes. They prevent dust from getting into your eyes.
Okay.
So that hair there also prevents things from getting infected and things like that.
Okay.
But it might be a little harder, especially for things like sweat. You know, hair traps sweat.
Yeah.
So for some people, they might want to cut off the hair that's there. So that's a personal choice.
All right.
And as to how you should cut that hair, many things. You can use a pair of scissors. For people who are particularly prone to getting ingrown hairs, so you can use clippers or scissors so that you're not cutting to the root, so that the hair doesn't need to sprout out from the skin. It prevents you from getting ingrown
So you
hair.
avoid using razors.
There are people who also don't have a problem with using razors. It's also an acceptable option to use a razor. But when you're using a razor, you have to make sure it's a sharp razor.
Yeah.
So you use once and you discard. And yes.
And you shave according to the grain.
Yes, when you're shaving, you shave according to the grain of the hair.
Yeah.
Because I know sometimes shaving against the grain gives you a closer shave to the skin and it feels smoother, but it's not good.
It comes back itching.
Yes, it
At
can.
least that one we understand as
Yes,
men. That
yes,
one, yes.
yes, yes.
All right.
And then also things like waxing. Also, it's okay. It's painful, but for people who can tolerate it, there is no harm in waxing, and even doing laser.
Yeah.
It's okay because it permanently removes the hair from there. It's fine. And then there's also things like hair removal creams. You have to be a bit careful with hair removal creams though, because they can irritate that skin around there. So it's always best to do a skin test elsewhere before you use it.
Any of these.
Yes.
There was one trend some years ago. I think it was even during the COVID period.
Yes.
After people had been indoors for quite a while. Sunshine, where you lie on the ground and let the sun shine where it usually doesn't shine. Is that safe? It's like exposing the vagina to ultraviolet rays directly.
Not really. There is no health benefit to doing that.
Okay.
I don't know why people were doing it.
The internet has strange things.
Yeah.
But when we come back, we'll be looking at some more of these trends and myths and debunking some of them right here on the Med Squad podcast. Welcome back to the Med Squad podcast. We're talking about vaginal health, and we are now saying use water instead of Gwyneth Paltrow's soap. But that is a take for another day. Right now, I want to talk about something that I am not familiar with. It's called douching. What is douching and also steaming? And what are they used for, and are they recommended?
Okay. Now that you talked about, I think it was actually a candle that Gwyneth Paltrow did that was called My Vagina, and apparently it had the scent of her vagina. But speaking of feminine hygiene products, let me ask you, have you ever heard of masculine hygiene products? Ever? For the
Yes.
genitals?
There's only one, but that is for shaving and taking care after you've shaved the the boys. Yeah, that's the only one I've heard of, but that was in the UK.
Yeah, so that tells you something that vaginal hygiene products is an industry that maybe people are just
It's still fledgling, or they don't
yes,
know much about it.
yes.
Yeah.
So about douching, douching is the practice of washing the inside of the vagina. Yes. And we said it's because of misconceptions on how discharge should be and order and to make your partner feel good.
Yeah.
So some people use water, some people use soap, some people use bleach, some people use
Bleach.
toothpaste,
Okay,
some
no.
people use antiseptic, some people use acidifying agents like vinegar and such.
Vinegar.
Yes.
They don't love themselves?
So the thing is, there is really no health benefit
Yeah.
to douching. Douching only gives you problems. So when you're douching, depending on what you're using, you might irritate the vagina. Can you imagine putting bleach into the inside
That
of
whole
the
list you've
vagina?
given, antiseptic, bleach,
Yes.
vinegar.
Yes. So it can cause dryness, it can cause irritation,
Yeah.
it can cause scarring, it can predispose you to getting what we call vaginitis and even sexually transmitted infections as well.
It predisposes you to that.
Yes, because it washes out the normal flora.
Yeah.
You get vaginitis. The area becomes a little more vulnerable, so to speak, because you can imagine if you're having intercourse and there's no lubrication in the vagina, you're getting micro tears.
Yes.
So if a virus is deposited there, then it has a free pass
Direct
into your
access.
system.
Yeah.
Yes.
And steaming is also part of.
Steaming is a little different.
Yeah.
So steaming involves sitting on something that's producing steam. So
Like a basin of hot water.
yes. So a basin or a bucket of hot water, and there's maybe herbs or oils or whatever inside there, and sitting on top of it to steam the vaginal area. Really, there is no proven health benefits. And you can actually burn your perineum very badly.
Yeah.
You can imagine sitting on a bucket and then something happens and you trip and you fall into that bucket.
Yes.
It can be quite hazardous.
Oh my goodness.
Yes.
So, hey, this sounds excruciating, and I'm also getting a lot of it coming from male pressure. Aye, man, why are we like this? But when it comes to the odor or unusual discharge, when should a woman be worried about the odor?
Okay. All right. So I'm going to talk about a number of things. Number one, I'm going to talk about what we call vaginitis. So the commonest cause of either abnormal smell of the vagina or discharge is something called vaginitis. Vaginitis is inflammation of the inner lining of the vagina. So the commonest causes of vaginitis, number one is called bacterial vaginosis. Bacterial vaginosis usually happens as a result of the shift in the pH of the vagina. So the vagina is usually acidic. The pH is about 4 to 4.5. So if anything happens and it changes the pH and raises it, then you can get proliferation of abnormal bacteria in the vagina. And that is basically what bacterial vaginosis is. Some of the things that can predispose you to bacterial vaginosis include things like douching. So washing the inside of the vagina. Number two, sexual activity as well, because semen is basic, alkaline. So sometimes that can also predispose you to that. And then some sexual practices as well, like anal sex because you're transferring, we had said there is normal flora everywhere.
Yeah.
So you're transferring bacteria from the anus into the vagina.
Yeah.
And this could happen through maybe fingers, a finger is put into the anus and then into the vagina. Through fomites as well, like sex toys.
Yeah, sex
It's put
toys, yeah.
back there and then to the front.
Okay.
And then things like oral sex as well.
Yeah. Which also kind of, I don't know, it's a weird question.
Yes.
But if someone performs oral sex
Yes.
on the lady
Yes.
and has either even a cavity,
Yes.
it can actually infect.
Yes, it can actually infect, and even without a cavity, the mouth has bacteria that is not normal for the vagina. So if you're introducing bacteria from the mouth into that area, then of course it can bring about problems.
Okay.
And with bacterial vaginosis, the discharge usually characteristically is watery, grayish, whitish. It can be irritating sometimes. It can cause pain when you're having intercourse.
Yeah.
And characteristically, is very noticeable during intercourse.
Okay.
Because the penis goes in and it comes out with that discharge. So you will notice it during sexual intercourse
Okay.
mostly.
All
So
right.
if you notice something like that, then you need to go to a doctor. Another thing that commonly causes vaginitis is candidiasis. Candidiasis is a yeast infection.
The yeast infection, that's the term, the other word for or it's a type of yeast infection?
No, candidiasis is
yeast infection.
Yes.
Okay.
Yes. It's called candidiasis because the yeast that causes it is called candida.
Oh, okay.
Yes, so that's why it's called candidiasis.
Okay.
Yes.
That
So
explains.
candidiasis most of the time will happen due to use of antibiotics, immunosuppressive conditions like HIV, poorly controlled diabetes,
Yeah.
people who are taking immune suppressants because of autoimmune disease or transplant patients, sometimes they can be predisposed to candidiasis. Candidiasis, characteristically, the discharge will be, it will not have any smell, but it will be very itchy. Very, very itchy. It can cause swelling of the vulva and sometimes even fissuring around that area.
Yeah.
And characteristically, it looks like maziwa mala, homemade maziwa mala. So it's cottage
yes.
cheese kind of. So it will be clumpy and then it's going to have very watery bits in it.
Yes.
And then another cause of vaginosis would be trichomoniasis. So trichomoniasis is a parasite that is sexually transmitted. The discharge characteristically has a fishy smell,
Yeah.
and it's usually frothy and it's greenish.
Wow.
Yes, and it can also be very irritating, causing painful intercourse.
Yeah.
Yes.
That one you should know immediately.
Yes, that one you should know immediately.
Yeah.
Yes.
So what's your recommended hygiene routine?
We've already done that.
Okay. Wait.
So maybe let me just continue on the discharges.
Okay.
That's why I was
So
saying
ignore that. Ignore what I've just said. She's
Yeah.
continuing on the discharges.
on the discharges.
Twende.
Okay. Another thing that commonly causes abnormal vaginal discharge are sexually transmitted infections.
Yeah.
So these are different from the vaginitis. So they include things like chlamydia, gonorrhea.
Super
Others
gonorrhea also.
Others might not cause discharges per se, but will cause ulcers or lumps and bumps in the vulva. Things like herpes, syphilis,
Yeah.
and then there's others. Hepatitis and HIV really might not give you something that you can see physically, but those are also STIs.
Yeah.
So these STIs, the symptoms might range from them being asymptomatic, especially in females. In males, they will know for sure because they get painful urination and there's a discharge that comes from the urethra.
Yeah.
So a common complaint that young men might come to you saying is that I get spontaneous ejaculations, like I see sperm coming out through the urethra. it is not sperm. It's
Okay.
an STI.
Ooh.
Yes, it is an STI. And especially in young men,
Yeah.
another thing that young men might commonly be told is that you have a UTI. UTIs don't commonly occur in young men. If you have painful urination, chances are you have an STI
Yeah.
that has infected your urethra.
Yeah.
So, of course, it's presenting with the symptoms of how a UTI would present like.
Okay.
Yes. So, in addition to the vaginal discharges, is that these STIs can infect other surfaces that are used during during sexual activity. So the mouth, you can get infections, gonorrheal infections of the throat and the anus as well.
Wow.
Yes.
So there's some when you mentioned the discharge, the one that looks like maziwa mala.
Yes.
And all that. This is just from friends who are open enough with me, talking about how a lot changed in their vaginals infrastructure after pregnancy or after childbirth. How worried should someone be, or for how long after natural birth or vaginal birth should someone be concerned about anything in the vagina? Like, let's say either discharge or changes or something, because the tears also kind of.
Okay, so we expect that the structure of the vagina goes back to normal within approximately 4 to 6 weeks. So for some people, it might take as long as 12 weeks. So usually you go back to how you kind of were before pregnancy.
Yeah.
So the discharge should be as it was before. But even when immediately after the pregnancy, we expect that you will get some sort of bleeding coming from the vagina for some time.
Okay.
But it should just be blood, no foul smell or anything like that. So if you see things like pus, foul smelling, whitish discharge, or even bloody discharge that has a foul smell, either fishy smell or a rotten kind of smell, then that is not normal.
Not normal.
Yes. And as we are on that question about discharge and orders, maybe I could talk about something that has been the buzz on social media, the use of boric acid. Yes. So there is this whole fad of using boric acid to get rid of vaginal odor. That is not the right use for boric acid.
Okay.
Boric acid is not used to prevent an abnormal vaginal smell.
Yeah.
If you have an odor, like I said, you need to go to the doctor.
Yeah.
There is a role for boric acid in treatment of candidiasis. So it's been used in the treatment of candidiasis, and it's also been used in the treatment of recurrent bacterial vaginosis. So if you're getting a recurrence of abnormal discharges, you need to go see your doctor, not just to use boric acid.
Yeah.
And boric acid should not be ingested. So when you're using boric acid, be cautious.
Yeah.
Because of receptive oral sex, your partner might actually ingest it, and it might be
Dangerous.
fatal.
Wow.
And if you're getting recurrent abnormal vaginal discharges, we used to think that in the treatment of vaginitis, you don't need to treat the partner. But now there is new evidence that treating the partner actually reduces the recurrence of episodes of recurrent vaginitis.
Yeah.
Yes.
Okay.
Yes.
Wow.
Yes.
When we come back on the Med Squad podcast, we'll be landing this plane and talking a bit more about removal of shame. Stick around. This is the Med Squad podcast. We have candid conversations about health and wellness across Africa. And this is also where health meets humanity. Now, when it comes to candid conversations, there are very few conversations that are as candid as that about vaginal health. But we have wonderful Dr. Mbuche here to help us get through this. And when we left off, we had talked about the things you don't recommend for people to either ingest or apply to their vagina. But is it true that diet can affect vaginal health, and how?
So it is very true that diet affects vaginal health.
Yeah.
So number one, you need to eat a healthy, balanced diet. Water is up there
Yes.
on the list.
Yes.
So lots of water, and then a balanced diet that is rich in vitamins, your vitamin C, vitamin E, because these things help with your immunity and healing
Yes.
as well. And then cut on high fat diet, as well as processed sugars. Yes.
Yes.
And then there are things that we call prebiotics. Prebiotics are good. They are non-digestible plant compounds that usually feed the normal flora.
Okay.
So they include things like onions, garlic, asparagus, leeches,
Yes.
and leech, not leeches, leech. Yes.
Now those are the ones, the same garlic that's going to unleash an odor over there.
Yes.
Okay.
Yes. But it's very good.
Cooler too.
So yes, and also probiotics.
Yes.
So probiotics are living organisms that have a symbiotic relationship with our linings, like the gut and the vagina and things like this.
They support.
Yes, they support the health of those microorganisms.
Okay.
So you can get probiotics from fermented foods. So mursik, kombucha, maziwa mala, yes, kimchi, if you're Asian.
Okay.
Yes.
Oh.
Yes. So those are good. And how they work is that it's kind of that area there in the perineum. Organisms usually move freely around that area, because you might be asking yourself, how does something that I ingest orally and comes out through the anus, how does that help the vagina then? Yes. So that good bacteria will migrate and it will colonize the vagina. Yes.
So it will jump out of the digestive tract and go.
Yes, and walk on the skin and yes, maintain the vaginal health.
Okay.
And also there is some immune modulation. So immunity, basically it has to do with immunity and vaginal health.
Okay.
Yes.
Now, there are some people who are watching, and every time I say vaginal health, they're like, what is this man talking about? How do we raise our daughters and encourage or empower young women to to own and either be open about or actually just care for themselves in terms of their bodies, in terms of vaginal health, without shame?
So number one, it's talking about it openly.
Yes.
Like I said, no euphemism.
No euphemisms.
No wee, no choo-choo, no
Coochie.
susu, no nothing.
Okay.
You call it a vagina and you call it penis when you're telling them.
Yeah.
Okay? And we need to teach them from when they are very, very young.
Yes.
So young, as early as adolescents, it's good that they know, because they are becoming women then. It's probably they will get their first menses and things like that. So you need to tell them about what to expect, what is normal, because a lot changes, including the smell of the vagina, because the sweat glands around adolescent, that adolescent's age usually changes. They have a little bit more, if they are younger, they don't have body odor. Then maybe when they get to 11, 12, You're like, hey, my daughter now,
Yeah.
the armpits are a bit oniony and
Yeah.
things like that. So a lot of things change, including the smell of the vagina and the discharge of the vagina. So we should empower them by talking to them.
Yeah.
So through maybe peers, them talking to each other, as parents as well, talking to them. If as a parent you cannot have that conversation with your child, you can take your child to the gynecologist so that they have that conversation as they grow up. So having age appropriate reproductive and sexual education as well. And then as they grow up and get to their reproductive age as well, they need to know about things like fertility, common gynecological conditions and things like that. And then even at the point of transitioning to post-menopause, so that we are not only focusing on one group and forgetting the other. For this postmenopausal group especially, there's something called genitourinary syndrome, which is a very big thing for them. So it will usually give these women dryness of the vagina, abnormal discharge, and these irritative urinary symptoms that they really do not understand. They have to go to the toilet every time. They feel pain when they are urinating. They have this discharge. They take antibiotics. Stay for 1 month, it comes back again. Stay for another month, it's just them in and out of the hospital. And it actually has to do with estrogen. If you just supplemented their estrogen, most of these symptoms go away. So age appropriate.
Age appropriate.
Yes, throughout the reproductive career and even after.
Yes.
Yes.
And no euphemisms.
No euphemisms.
Now, finally, as we exchange shame for information, just a lightning round, just some quick, knock them out of the park. What's the worst myth you've heard about vaginal health? Apart from the soaps and candles.
The vagina smells like pineapples or whatever, or should. No, it shouldn't. It's not a pineapple. Otherwise, it would be a pineapple. That's why it's a vagina.
Okay.
Yes.
So, which, like, if there was one food you had to recommend that actually helps with vaginal health, is there one you can name that is up
Water.
there? Water.
Water.
Okay.
Water is on top of the list.
All right. Now, this one is one that was asked: period sex, yay or nay, in terms of, well, medically speaking.
I would say it's a personal choice, really. Really, yeah. If you're comfortable, then go for it. If you're not, then you wait it out.
All right.
Yes. But of course, with that, during when you're having your period, you're a bit more vulnerable to getting infections, because you know there is the sloughing off, the lining comes out, so it's like the blood vessels are left open, so a bit more vulnerable to getting infections around that area, around that period.
Oh,
yes.
during the. Oh,
Yes,
okay.
yes.
All right. Now, this other one says yoni pearls, helpful or harmful?
Yoni pearls, I would say harmful, because number one, we don't know what goes into those yoni pearls. We really do not know what it is. It's herbs. What is it? Is it chemicals? Is it, what is it? What is the dosage of those things? And what are the hygiene conditions under which these things are packed? Is it someone in industrial area putting some herbs into a piece of cloth and selling it to you? How safe is it? Yes.
Okay.
Yes, because they are not regulated. They are not regulated by the Pharmacy and Poisons Board. So we really don't know what's in those. So I would say harmful.
Okay.
Yes.
And finally, what would you wish every woman knew about her vagina?
That the vagina is beautiful. There is nothing to be ashamed of. The vagina has a normal mild odor and it has a normal discharge. And you should not be ashamed because of that. Know what's normal for you, so that if something abnormal happens, then you ask for help.
Thank you, doctor. Thank you so much for informing us without shame. No euphemisms, talking about the vagina and vaginal health. Thank you.
Thank you.
We appreciate this.
Thank you for having me.
And for you, well, you know it's not about smelling like roses or pineapples. It's about taking care of your body. It is your body. And as Doctor has said, it is beautiful. You are fearfully and wonderfully made. Take care of your body. This is the Med Squad podcast. You can follow us on all our platforms at the Med Squad Pod. And as we have candid conversations, you can inbox us if there's anything that you want us to address, no matter what it is, medically speaking, of course. Share this episode with someone who might need it. See you next time.